It's now 12 o'clock, and we want to welcome you to the 7th Flint Community Webinar on COVID-19, this first day of May. We're so excited that you've been able to join us. We have a number of viewers on this morning, and we're expecting more. I'm your host today, Yvonne Lewis, and you can see all that information there. I'm just glad to be with you today as one of the co-directors of the Health of Flint Research Coordinating Center. And we're bringing this information to you to help us to see not only what's happening at the national level, but what is also happening at our local community level and what programs and services are being developed to ensure that our community is doing our best to protect and prevent the COVID virus during this season. So we want to welcome you again today. We have a wonderful lineup for you today. I think that many of you knew that we were anticipating having our special guest today, Congressman Dan Kildee. And we're excited because we got a call earlier this week and that he let us know that he would only be available for 30 minutes. Shortly after that, we also received a call that said, not enough. We need to be with you for the whole hour. So Congressman Dan Kildee will be with us next week for the full hour to share with us about what's going on at the federal level. But what we're excited about is that he also wants to hear what's happening here for us locally because he's our advocate in Washington, D.C. So we thank you for joining in with the intention that you would hear from him, but we want you to know, sign up. We will be registering for our webinar for next week, and he will be on for the entire hour next week. But today, we have a wonderful program outlined for you, beginning by answering some of the questions that came up from last week's webinar. You know that we've been talking about testing, which is really, really critical for us in the community. And Hurley Medical Center stepped out first to do the community testing based upon the request by our governor. So we have Dr. Tupper on with us today. Dr. Tupper is going to talk to us about what Hurley Medical Center is doing and how they've stood in the gap for these first 2 weeks and what's happening next. So Dr. Tupper, we welcome you today, and we want to hear from you about what's happening with Hurley Medical Center and the testing process. Yeah, Dr. Tupper, I think you have to unmute. Okay. Yeah, there you go.
Should be unmuted now. Yes. Thanks, Yvonne. Yeah, I'm coming again from the Atwood Testing Center here, where we, as of today, will have tested nearly 500 people for coronavirus over the last few weeks. Monday is our last scheduled day to run the testing center as we plan to transition into more community-based options. And so what we've done is bridge the gap while other community testing centers can come online, whether that's at Hamilton Clinic, at private physician offices, at our urgent care. But we are open on Monday as well for testing. In accordance with guidance from the MDHHS with regards to testing prioritization, we have expanded our testing such that if you have any symptoms of the coronavirus, you can call our hotline, get an appointment. At this point, we'd be scheduling for Monday, and we can test you. So we've really increased our testing capacity, have tested a lot of people. We're seeing, as far as our results rates, which I think is a good thing, we're seeing less and less people of the percentage that we test positive, which is good because it means that the measures that we're implementing as a community, as far as staying home and staying safe, are being effective in decreasing the impact of this virus. And the goal next week is to continue testing, but transition into more traditional care models and other testing centers.
So thank you, Dr. Tupper. Just to be clear, that in the hospital settings, when people present at the hospital, you will still be doing testing there following May 4th.
Absolutely, yeah. So we're continuing to test in the hospital, and we continue to expand our criteria for testing. We're testing in our urgent cares. We're testing in other community offices and other community settings. Other mobile testing options are coming online, so that the testing capability is increasing. We're getting increased capacity from our own labs and from the labs that we send, so that we're getting faster turnaround time for results. And so the testing continues to expand.
I think the exciting thing is, and I'm looking at this and I'm like, this is real time TV. You are standing out there right right there on ground zero, if you will, making sure that these tests are happening. And I think the community would be excited to know that there is an improvement in the processing time of these tests so that the results are coming more quickly.
Yeah, that's correct. When we started, it was often many day delay in getting results. At our testing center here, we're sending the results to a lab in Ann Arbor, but we're getting results for the most part the next day. So we're finding out our test results next day. In the hospital for patients being admitted, we're able to get same day results. So that's a significant improvement in our efficiency and operations. Just knowing the results in a faster time frame.
That's awesome. Thank you, Dr. Tupper. We appreciate you. And as long as you can stay on with us in case there's some additional questions, we appreciate that. So for those Dr. Tupper out in the field, he may not be able to answer your calls, but we've got a team in the background that can pull those questions up, and we'll make sure that we can get them to him if there are questions that we need to have answered. So thank you again, Dr. Tupper. You mentioned the fact that community-based sites are being put in place. So we have back Clarence Pierce, who is the CEO of Hamilton Community Health Network. And so, Clarence, we're excited because you've got a couple of sites that you're going to talk to us about today. So help us to know what Hamilton Community Health Network is doing with respect to testing.
Yes, good afternoon, Yvonne. It's good to be with you again. Yes, we have another site starting up services next week on Tuesday, 9 to 4. And Thursday, 9 to 4. That will give us 2 locations where we will be testing at our North Point location on the north end and our south end site there at G3375 South Saginaw in Burton.
And so talk to us a little bit about who can get tested and what your process is, Clarence.
Yes, well, I have the COO, Chief Operating Officer here at Hamilton with me, and Sherry Pace, and she will give sort of those updates on that.
Thank you. Welcome, Sherry.
Our process is very similar to what Dr. Tupper was saying for Hurley. We have established a COVID hotline. It's our Hamilton COVID hotline. That's 810-406-4019. People can call that number to schedule an appointment. Our process is 2 steps where we are going to have the patient call in and schedule an appointment for a telemedicine visit where they'll be screened for symptoms of COVID. The requirements and criteria have been relaxed quite a bit. So any frontline worker, any worker who is considered critical, pretty much if you have, they're open to be tested. So, but we have to go through and have a visit with our provider so that we can place an order. And then we would put them on our schedule for drive-through COVID testing. So the drive-through testing is by appointment only, and that is following a telemedicine visit that happens prior to that.
So you have some really important structures put in place that you want the community to be sure to follow. And so one of the things we want to remind people is to please call for that appointment. That's the first step. And then you'll guide them from there.
Correct.
So again,
Yvonne, let me just say too that it doesn't matter whether you're uninsured or insured. We're prepared to see you in any case. Just make the call, set up the appointment, and we'll do the rest.
Okay, we do have a couple of questions while we're on this testing conversation, and either you, Clarence, or Dr. Tupper can answer these. The first question is, you're testing. But there's been some conversation about it not being comfortable, and this has really actually gone viral. And so can you talk to us a little bit about the testing procedure that's used so that people can get over the discomfort and not listen necessarily to what's going on in some of these media sites? Dr. Tupper, can you help us with that question about the testing, the actual, you're using the nose swabs?
Yeah, so there's a few different tests that that are out there, and the main thing I want to emphasize is if you are having symptoms and you want to know if you are actively infected with the coronavirus or not, the current best test available is a test called a PCR, and that is a nose swab.
Okay.
And it's I would say it's mildly uncomfortable. It is a deep swab up the nose, but it's very brief. And so I would say pretty much everyone tolerates it. It's not a pleasant experience, but it's very slightly uncomfortable and it's very quick. So that is the test for active infection. Any additional tests that are currently under evaluation that are blood tests are usually antibody tests. And the role for those, we're still researching and still trying to understand. But what those tests are most designed to indicate is whether you've had the infection and are now making antibodies. But those antibodies in your bloodstream take time to accumulate and time to be able to measure. Mm-hmm. So if you have symptoms of the coronavirus while you're symptomatic, the best swab is to test up the nose for the virus. And yes, it's a little uncomfortable, but everyone tolerates it. Everyone does fine. We haven't had anyone too upset by it.
Thank you, Dr. Tupper. And I think what's important for our listeners to understand, because again, we realize many of you are out in community helping others to understand what's going on and the availability of these tests. It's just important that our community, when the opportunity is available, to get tested, because that's going to be an important piece of the conversation. We're going to talk about this a little bit later on, but it is really important for us to have this opportunity to get tested. Just before we leave this, Clarence, any other information that you'd like to share with our listeners today?
And I think you hit on it, Yvonne. The main thing is to have access to testing. And that's why we have made an effort to get started up on the north end. We know that in many cases, the African-American community is by far one of the groups that seem to be more susceptible to the infection. And so we want to make services available for testing so that they can come in and get tested. So I would suggest that anyone who may be feeling ill or may think that they are having some problems, to please come on in, make that call, and we'll get you set up to be tested.
Thank you, Clarence. And I understand, and we just to reiterate that Dr. Tupper just shared with us a few moments ago that the turnaround for the testing is increasing. So we're getting those results back more rapidly. So this is really important. And you touched on something else, Clarence, that's really important for our listeners as well. We've been talking about disparities and the differences of the outcomes after people have been infected. So we really know, again, that the testing is so important. We're going to talk about that a little bit more. We want to move to our next presenter. Suzanne Kupel at the Health Department also has some insights for us about testing sites and some updates from the Health Department. The Health Department is a critical key player in what's happening in our community with respect to assuring our health as a public. So Suzanne, please give us those insights that you have for us today.
So hello everyone, and I want to let you know that as of yesterday, we had 1,582 positive test results for COVID-19 and 188 deaths. Just a reminder to everyone that these numbers may not be reflective of the true number of COVID-19 cases in our community because of limited testing. So we do want everyone to recognize that testing is important, and I'll share a little more information about that in a moment. I do want you all to know that though the McCree South building for the Health Department is closed to the public, that our staff are still available and are assisting with any needs that our community members have. Our Burton location is still open by appointment only, and we are servicing our WIC clients. Again, many of our staff are working remotely, but we are doing appointments at the Burton location for WIC, family planning, immunizations, and sexually transmitted infections. So we're very, very pleased to have Hamilton Community Health Network come on board to assist with testing in our community. We have also another site, Rite Aid Pharmacy of Swartz Creek. They are providing testing Monday through Friday, and they are open from 9 a.m. to 5 p.m. And their testing screening process is made online at the Rite Aid website. We also have a group of physicians, Michigan Health Specialists, who are providing testing at 2 of their locations. Their call number for making an appointment is 810-235-2004. Again, 810-235-2004. The first location is located at 2065 South Center Road in Burton, and the second location is at 2700 Robert T Longway in Flint. So those are the community testing sites that are available at this time, and we are working very closely with the City of Flint, Michigan Department of Health and Human Services, the Health Department, and other community partners trying to identify additional locations for community testing. I also want to remind you that Genesee Health System is providing testing that is not open to the public, but they are assisting with mobile testing in group home settings and assisted living settings. So they are actually taking their mobile units to those locations for those individuals who cannot come to a testing location. So that is the update for the testing sites at this moment, and I'm happy to take any questions anyone has.
Suzanne, I'm so happy that you shared about the mobile unit, because we've gotten a number of questions about what happens in the nursing home and assisted living facilities. So this is really important. What we'll make sure that we do, I do want you, Suzanne, just one more time to repeat those 2 locations for Michigan Health Specialists. We'll really make sure that we get this up next time, because I think it's important that people can see these locations. So the one is in Burton and the other is in Flint. Can you give us those locations one more time?
So I'm going to give you the telephone number again, 810-235-2004. Location number 1 is at 2065 South Center Road in Burton. The second location is at 2700 Robert T Longway in Flint.
Thank you so much. Thank you very much. Now, I want to remind you that have joined us on the webinar today that our panelists are behind the scenes. Thank you so much, panelists, and ready to answer any questions that you may have regarding the conversation today. And you may have some questions that you will stimulate us as we're working to develop our future seminars, or webinars, excuse me. So the panelists that you see here on the screen, they are available, ready to ask questions. So go down to the bottom of your screen, hit that Q&A button and load in your questions, and we'll do our best to make sure we respond to you today. We wanted to just remind you again, we heard a little bit about the differences. And so in our community, in mirroring what the state has done, we have a task force right here in our community. The Community Foundation of Greater Flint is taking the lead on the task force on racial disparities as it relates to the coronavirus. And I must say, someone mentioned to us earlier this week that when we use the term COVID-19, which is a short way of saying coronavirus, year 2019, many people lose the emphasis of how important this is. So we do want to make sure that it's clear coronavirus is very, very serious, and we're not minimizing it. And so the Flint community has put a task force together on racial disparities to really take a look at why we're seeing the differences between the number of African Americans who are tested and test positive, going to the hospital, but are dying disproportionately. We want to make sure that we give attention to that. So if you want to know more about it, we had Brother Isaiah Oliver on, who is the CEO of the Community Foundation of Greater Flint. Their website is on the bottom of the screen here. You can go on that website and inquire. We want to also remind you that they have a rapid response grants program. They have given out, as you can see, over $765,000 in grants already since it started. This is as of April 16th. They are continuing to raise money and to also read grants on a weekly basis. So if you're doing work in this community and you want to get some additional resources, follow their process now, follow the process, but there are resources being made available to specifically address some of the issues that we're identifying here as critical issues in our community as a result of the coronavirus spread. This is important, that it links to what the state is doing. And we do have on the phone with us Sharonda Grigsby, who is a consultant at the Michigan Department of Health and Human Services. She's a public health consultant. And we've asked her to come on today again because the Office of Minority Health and Health Disparities, they are working diligently to make sure that resources are also available. So they have a specific capacity building grant opportunity we'd like her to speak to. So Sharonda, if you would talk a little bit more about this opportunity that's available for the residents of the state of Michigan, which includes those of us here in Genesee County.
Good afternoon, everyone. As Yvonne mentioned, on April the 17th, we did release a Minority Health Community Capacity Building Grant opportunity. The grant opportunity looks to award up to 5 organizations at a level of $42,000 for 3 years. So the organization, if successful, the organization will receive $42,000 for 3 consecutive years to address community level projects that address social determinants of health, looking at policy, access to care, data collection, and things of that nature. We did have a pre-application conference call on yesterday. And for those of you who weren't able to join the call, we will be posting that information on the eGrams platform within the department for access. We did record. We did have some technical difficulties during the conference call yesterday, but in light of those technical difficulties, we'll be extending the Q&A period by 1 week. So if you have questions, once you review the grant opportunity, if you have questions, you can email those questions to Brenda Jegaday at jegadayb@michigan.gov. That's JEGEDEB@michigan.gov. So we will be posting the initial questions that we received during the conference call yesterday by May 6th. Then an updated document will be posted on the eGrams platform by May 15th. So any additional questions after May 6th, we'll post those updates on May 15th.
Thank you, Sharonda. And I'm really excited that you are here in Flint as a resident, also standing in the gap for us at the state level. And something we've talked about a lot as we talk about these minority health issues. One of the biggest things that we see is sometimes there are culture and language barriers. And I just want to make sure we reemphasize, or if you would reemphasize, that you have some materials available as these programs are being developed that can be utilized by program developers.
Absolutely, Yvonne. And in addition to those resources that we have available, we do provide technical assistance all throughout the grant period. So we do connect, we do consult and contract with a cross-site evaluator. For those individuals who are funded to do this work, we connect them to that cross-site evaluator. So that evaluator is able to help them do lit research, data analysis, different things to strengthen their evaluation plan. So we have a ton of resources and we provide ongoing technical assistance throughout the grant process.
Thank you, Sharonda. And I know this to be a very important step in many of our community organizations that seek to work in this area, because this issue of health disparities isn't new to us. It's been around for a long time. The coronavirus has also elevated this discussion for many of us. And so it's really important that we take advantage of these opportunities. And I want to say advantage in terms of utilizing the resources that are available to us. We want to move now to talk about something that just happened. Yesterday, the governor signed an executive order that expands the Save Lives and Protect Michiganders to May 28th. There were some questions about it, and this is another reason we're so excited about being able to do these webinars for you every week. That is, we can bring you updated information and hopefully clarify. The question was asked whether or not what happens as a result of the 15th. Is it the 15th or now the 28th? Well, we want to clarify that the state of emergency remains in effect under the emergency powers of the governor. And this will continue now through May 28th at 11:55. So our whole issue of staying safe, staying distancing, the distancing is still in place until May 28th. You remember Dr. Tupper said they're seeing some decrease, and he attributes that to the work that's already been done by the residents in our community to follow these guidelines. So we want to encourage you to continue to do that through May 28th. We know our mayor supports this. And so we want to just make sure if we're going to see things change in our community, it's going to be up to us to help make that difference. So again, we just want to remind you that the governor has extended the emergency until May 28th, 11:59. So we want to transition a little bit to talk about something that has been going on in our community for a while from a community-based perspective. We've experienced from the water, even prior to the water crisis, we've been working in partnership with academic institutions for many, many years. As a matter of fact, this very webinar is put together as a partnership between the University of Michigan, Flint and Ann Arbor, Michigan State University, and community partners, which form the HFRCC, or we call it the Healthy Flint Research Coordinating Center. A part of that is what we know as the Community Ethics Review Board. Ms. Ella Green Moten, who is here with us today, is the administrator for the Community Ethics Review Board. And we're going to just ask her to come now and just share with us how we help to manage research, if we can say that, at least coordinate during this COVID-19, coronavirus-19 pandemic. So Ella, tell us about the work that you're doing, particularly as it relates to the Community Ethics Review Board.
Absolutely. Thanks, Yvonne, and good afternoon, everyone. And in my role as administrator of the Community Ethics Review Board, I'm going to talk a little bit about the correlation between the city of Flint, the COVID-19 pandemic, the Flint water crisis, research in general, and how my partners and I have decided to attempt to manage one aspect of this place of constant change and unpredictability. Next slide, please. For the past several weeks, the HFRCC has hosted webinars dedicated to providing information and resources on the community's basic and immediate needs to assist residents in navigating through the COVID-19's silent, odorless, colorless, and tasteless, death-imposing grip, which has and is wreaking devastation on our communities in Flint, across the country, and around the world. Next slide, please. But the reality is that the Flint community was already in crisis as a result of the Flint water crisis. And so what we know is that Flint had already become a research mecca, where researchers were drawn to this community, and the number of researchers and research proposals escalated even more during and after confirmation of the water crisis. Next slide, please. We also recognized early on that not all of this attention was positive, respectful, or beneficial to the community, which introduced us to parachute research. Next slide, please. So being a community of quote unquote community researchers, With many years of research practice and experience under our belts, we had already begun to think about what our role in guiding and managing the research coming into our community could and should be, using this idea as a backdrop. We wanted to ensure that the conduct of research, programs, and services explicitly advocates for the protection, and that is doing no harm, mutual benefit, and equity at the community level. Next slide, please. So we landed here. The community-based organization Partners Community Ethics Review Board, which is the brainchild of our very own Dr. Ken Key, who began working on this concept as early as 2010, and which is now providing its ethical review services in partnership with the community core of the HFRCC in collaboration with the HFRCC as a whole, and is another very important resource and community level protection available to researchers doing or interested in doing research in this community. Next slide, please. So just to give a couple of points about the SERB. The SERB is comprised of Flint area volunteers, and it was established to examine potential and actual research proposals, programs, and services utilizing a community ethical lens to conduct. Next slide, please. The SERB's mission is to facilitate and implement an ethical review process that promotes an understanding of ethical conduct in research and demands accountability. Next slide. The goal of the SERB ensures, but is not limited to, community needs and concerns about research are heard, projects are sensitive to community culture, a feedback loop is provided that provides results back to the community for its use and benefit, and a written critique back to the investigator. Next slide. So if you have not done so already, I invite you to visit the HFRCC's website and consider submitting your work to the SERB to come before us and have this discussion to make your work better and to provide more protections for the community. Thank you.
Thank you, Ella. I appreciate that insight. Just want to take a few minutes, just a couple minutes, to talk a little bit more deeply about a couple of things.
Yep.
Flint's been a leader for a long time in working and engaging community academic partnerships. We go way back to early 1990s working with the university. This is unique in that community partners have an intricate opportunity, should I say, to make sure that there's no harm brought to the community, and that the research is really pertinent to communities. So can you just talk a little bit about some of the kinds of things we've seen since the SERB has been in action?
Well, there have been some eye-opening situations, I think, for both SERB members and for researchers. And I was thinking about that a little bit earlier today. And I think the one thing that, for me, that has happened across the board, regardless to the type of research that we're looking at, regardless to the experience of the researcher. We've had some beginning researchers, we've talked with students that are interested in becoming researchers, but regardless to where they are on that continuum, they learn something. They come before the SERB and have things pointed out that they didn't think about that would matter to the community. And that's what we're trying to do. This is not a body of community folk trying to tell researchers how to do their research, how to plan their research. You know, we just want to be sure that the research that you want to do complements the community. It's something that the community wants, and it's something that's not going to harm the community, but also that's going to leave some benefits for the community.
Yes, thank you, Ella. So one of the links that we want to make here for those of you that are listening, you've heard about the funds that are being made available by the Community Foundation. You've heard about the opportunity that the state is offering If you're involved in any of those projects, we want to encourage you that you visit with the SERB, have a conversation with the community core, the HFRCC, so we can help to connect these things so that when we're doing this work, we're sure that both the community is benefiting, the individuals in the community. We talk about the broader community, but
Right.
we also want to speak to the fact that we're putting something in place that will be lasting. So I think the capacity building work that the state is doing, the
Yes.
Community Foundation is doing to provide resources to community organizations really helps us to build that synergy necessary that we can see ongoing positive results in our community, and we have a way to keep track of that. So
Yes.
thank you, Ella, for sharing with us today, and we look forward to any of you that have information or ideas giving the SERB a call and
Yes.
let them know that you're interested in following up. So please be a part of this change, this difference that we're making in our community.
Absolutely. Thank you.
So we want to remind you again, there are questions. There are residents who are members of our team. They're resident now, I'm going to say they're sitting now waiting to answer your questions. So please feel free to continue to put those questions in the queue. I do want to acknowledge that we have Gary Jones on the line as a panelist today. Gary Jones is our Flint-based person working in the office of the governor. And so, Gary, I just want to make sure I give you a quick minute to tell us, maybe you even want to elaborate a little bit on that executive order, but just give us a quick tip out of the governor's office. And I'm throwing this in there because we do want to hear more from the governor's office on next week. But if there's a tip you might want to give us as relates to conversations with the actual state of Michigan.
Yeah, actually, thank you, Yvonne. And you did actually pretty good covering it earlier in terms of the extension that was put in place in regards to the state of emergency and the state of the state of emergency and the disaster declaration being declared until May 28th. And so I just wanted to make sure that everyone knew that I was on the call. And if there are any questions, definitely feel free to put them in the queue. And I don't want to take too much time away from the agenda, and I can follow up, with folks individually on those questions. But thank you for mentioning that earlier and acknowledging me on the call.
Okay, thanks, Gary. And a question came in, as far as we know, and this was related to the SERB. The question was, are there any other SERBs across the nation? And I think, Ella, you can come back. But as far as we know, we're the first one.
We're the only CERB, Community Ethics Review. There are some CIRBs and community IRBs and other things, but we're the only SERB.
Okay, and again, we want to just emphasize the focus of this is that no harm is done to the community and that the community is directly engaged in the process. So let's continue talking about community for a minute. We have some community partners that are on, and one of the key partners is our community, is our city, the city of Flint. Dr. Reynolds is on today, and here's the opportunity we need to hear from what our city voice is. And Dr. Reynolds, I know you sit in the office with the mayor, and when I mean that, I see you at tables with the mayor, so help us to understand some key critical issues that is happening through the city.
Well, good morning, friends and neighbors. First of all, I want to say it's the goal of the city to be as proactive in our response as possible because we recognize that we live in a community that has many health disparities, particularly for Black and Brown residents in our community. And so we have tried to get ahead of the curve, as they say, and that is why we were the first city to declare, the second city to declare an emergency. We were the first city to have a curfew. And these are not punitive measures. These are measures to protect the health of our friends, neighbors, and loved ones. So imagine where we would be now at this point, and I keep losing track of the weeks. It's 7 weeks since this was recognized. Imagine where the health of our residents would be had we not acted proactively. Now, everybody wants to know, continuing that proactive theme, okay, when are things going to open up? And basically, we cooperate with the county, the state, and when it makes sense, the federal government on making these decisions. And I won't get into all the issues related to what happens on the federal level, but I would say we would like to see at least a 2-week steady drop in the number of cases and deaths before we even enact a plan to partially reopen activities. And I am so proud of our governor who has held the line. Uh, I will digress and say, imagine if 100 armed people of color showed up in the state capitol. Would the outcome have been as peaceful and the same? But to the credit of the residents of Flint, when our mayor asked that there be a curfew, folks learned how to comply, and it was out of concern for our friends and neighbors. So we will continue. As you know, City Hall is not open, and so most of the work is done by a skeleton crew within City Hall, and I'll let you hear from Billy Mitchell shortly, but also by people connected by phone, Zoom, and computer, just as you are. But we are already making plans so that when we see this sustained drop in cases and deaths, we can open City Hall and safely serve our residents. And when I say residents, I mean anybody who lives in the city of Flint. So that is our goal. And there are also discussions as to how we can safely, in coordination with the governor, open the businesses and other things, especially the essential businesses in the city of Flint. But in the meantime, we ask, if you go out, wear a mask. You wash your hands frequently. Keep your hands from your face, but don't make unnecessary trips. And as I have said in other audiences, when you go shopping, you don't have to take Lottie Dottie and everybody. Just take one person into the store so others can get into the store. I have been most impressed about the care that Flint residents have had for each other in trying to comply with these rules. So let's look forward to that sustained 2-week drop in cases. When the governor says it's time to move, we are putting plans in preparation of that day.
Thank you, Dr. Reynolds. And I will come back to Billy. I just want to appreciate you because the two major things that came up for us last week was one, the testing, and the other, the reopening, because that is quite a concern. The idea that we're going to be looking at safe procedures in order to opening and how critical testing is to that. I just want to re-emphasize and make sure I'm clear that you're saying as long as the governor's state of emergency is in place, the city of Flint will maintain the curfew?
No, those are two different things. There's the state of emergency until 11:59. What is that, May 28th?
Yes.
There's the curfew, which will be in place until 11:59, May 15th.
Okay, so we just want to make sure that that distinction is made for our listeners, and we'll make sure we put that on our slide, that the curfew is in effect from 9 p.m. to 6 a.m. until May 15th. But
That's correct.
We want to follow the stay safe distancing based upon the emergency that was declared by the governor, and make sure that we follow the rules, even when we're going to eating and so forth, that we do that distancing.
And that includes going to worship, going to funerals, reducing, even when you have a meeting and you're having appropriate spacing of 6 feet apart, that it's limited to 10 people. If you can do so, I can't say what happens in everybody's house because you can't put your cousins out. But we try to observe those rules in public gatherings.
Okay, thank you. Billy, any quick updates about the water filter kits? What's your update for us really quickly, please? Are you there, Billy? Okay, well, we know that again, water restoration is still there. And as you said, Dr. Reynolds, the city is not open to the public, but their services are still being provided.
And let me give you that phone number, 810-410-2020.
Thank you.
410-2020. If you have your needs, you call that number.
All right. Thank you so much, Dr. Reynolds. Now, our community updates, we have some more. And when we have these updates, our panelists are coming on to give you some new information that is occurring based up on the programs that are available here in the community. So we're going to ask for an update from the Genesee Health Plan. Jim Melanowski.
Thank you, Yvonne. Just again, we are available remotely to help people. We have a full staff. A lot of them are on this call and getting updated on all the resources that are available, but we can still do enrollment and navigation. There was a question in the queue about language and culture barriers, and so Genesee Health Plan has bilingual health navigators that can assist Hispanic and Arabic members of our community if they have questions and need assistance connecting to resources in their language. We have our community health workers, prescription assistants, and I also want to talk just briefly about dental emergency. So most dentist offices are closed, but our dental coordinator, Corey Taylor, has been calling dentist offices and on how to access dental offices for emergency services. Who's open, who's not open. So give us a call at 810-232-7740. Ask for Corey, and she can assist people with finding where they can go for dental emergencies.
Thank you, Jim. We're learning as we go across the organizations that are presenting today. As different issues arise, I really want to know that our community organization and the leaders are working to try to fill these gaps and find out how to help us navigate through these difficult times. So we want to appreciate the health plan, particularly as it relates to the dental piece, because that, dental challenges are a real challenge, and we want to make sure we can help individuals in our community navigate that. The other really critical thing that's come up is MTA, and I know Harmony is on the line with us today as a panelist, and there's been some updates. So Harmony, can you clarify what's happening with our mass transit services?
Sure. Thank you so much for having me. I am really excited to share that we have a date for our fixed route services to be running again. So what you know as the city buses will start to operate again on Monday, May 18th. They will run an hourly service as opposed to 30-minute service, and fares will be waived until June 1st. We'll be asking people to enter through the rear of the bus, and they will be required to wear some sort of face covering or mask to board the bus. We'll also be practicing social distancing on the bus, so you'll see people spread out a lot more, and we'll add buses on routes as needed so that we can ensure people's safety. Our regional routes that a lot of our Flint residents or Genesee County residents use to get to work in other communities, we'll be restarting those on Monday, June 1st. And then our Rides to Wellness service, which many of the agencies that are on this call utilize for their clients, will start on Monday, June 1st also. So we are happy to be back providing mass transportation and public transportation to the community. But I'll just share real quick, we have not been just sitting packets to students, and we've partnered with Meals on Wheels to assist with delivery of meals to seniors. So even though you haven't seen the big buses going down the road, our drivers have been essential in ensuring people can get the things they need.
Thank you, Harmony. That's so. I'm just amazed at how our organizations are figuring out how to integrate these things, because there's so much that our community members need, and we don't want anybody to be left out. So you mentioned the Flint Community Schools and what you're doing with them, and so the Flint Community Schools has an update. We do want to just remind our listeners, as you've said, our participants here, as you said, they're still providing the meals. They wanted us to be sure, and Anita, I didn't see her on today, but we wanted to be sure that you knew these were available, and that the sites for distribution are still going on Tuesdays and Thursdays. And they did this in order to minimize that contact. We're glad to know that the school, that the MTA is working in partnership with them. So thank you, Harmony. We have another great resource in our community, the Greater Flint Health Coalition. And I do understand, and I'm excited that the CEO is able to join us today, Kirk Smith. And I know you've got some exciting, right now, up-to-date news that you're going to share with us so that we can understand better what the Greater Flint Health Coalition is now doing in light of this coronavirus.
Yvonne, good afternoon. Thanks for having me. As has been discussed, I think, in the previous week's calls, all Greater Flint Health Coalition community-based programs continue to be 100% available. The flyer on the screen gives you a number of different modes with which you can get assistance directly with things like healthcare coverage, getting connected to a medical home, nutrition, physical activity resources, anything related with job training, job search. We have a number of folks from local industry that have become displaced and may need assistance with that, and we're ready to do that. I know one of the things, Yvonne, you were interested in having me talk a little bit about was an emerging group that started to work together this week relative to growing the local capacity to provide contact tracing.
Yeah.
So what is contact tracing, I think, is the first thing, is if we look around the world, some of the places that have been the most successful in flattening that curve and preventing unnecessary spread of COVID-19, they've done everything that our governor has been helping to make happen. But they've also had really strong and successful contact tracing efforts. And the state has been standing up, is in the process of standing up additional capacity to help local health departments with contact tracing. But we also wanted to make sure that local took care of local, because all health is local, and we know that. Contact tracing is when public health staff work to not only contact individuals who are a positive COVID-19 case, but to work with them to try to recall anyone who they may have been in contact with during the time frame when they were infectious. So at that point, ideally, public health staff can then reach out to exposed individuals to let them know of their exposure, make sure that they know about it as soon as possible, help provide them with education and information, and support them relative to their risks and what they could do and should do, not only to take care of their own health, but to protect the health of others proactively. Yesterday, we had the first meeting of the Flint and Genesee County Contact Tracing Work Group. This is a work group that the Genesee County Health Department and the Greater Flint Health Coalition are convening together. The idea is we have a number of very strong community programs that have skilled social workers, nurses, community health workers, and so on, that can be leveraged and volunteer to add additional capacity to support the local health department to make those calls. We're in the process of bringing together that list of individuals who have expressed an interest, not only to MDHHS, but locally, and so that we can reconcile that and essentially build up this local workforce of volunteers so that we can not only support this capacity now, but if there is an instance of future occurrences of COVID-19, maybe in the fall or winter, we will be prepared locally at that time to do this immediately. And that right there will save lives. The group will meet again next week, and we'll continue to provide updates as that process works. One other thing I wanted to mention, and this is really new within the last hour, one of the previous speakers talked a bit about the fact that this is not our first crisis. Obviously, we are still very much in the recovery phases of the Flint water crisis. And one effort in the community that is positioned to support that is Flint Recast. The administration and Mayor Neely earlier today just put out the Flint Recast 2020 RFP program for mini grants in the community. What Recast is there to support is focused on high-risk youth and their families impacted by the Flint water crisis. And the goal of the program is to support the community and community-based organizations to work together in ways that can improve behavioral health, empower community residents, reduce trauma, and impact sustained community change. These mini grants, up to $10,000 will be available, and up to 20 grants will be awarded in the community. This first proposal is due May the 15th, and the city will have an announcement that goes out within the next day or so. If you go online now, it is live on the City of Flint website.
Wow, thank you, Kirk, for that real-time, right now information. So again, it really fits in with today's conversation about opportunities for you to connect with other organizations, connect with the Community Ethics Review Board, partner and understand how best to make these resources work for our community. So thank you so much for that, Kirk. We'll look forward to hearing more updates from you. We just want to remind you that those individuals who are having some difficulties in maintaining their home, this stay of evictions is still in place. This is still in place. So follow that website and get more information. There's also the phone number for you to call. We want to hear now a clinical perspective. We always want to make sure we're keying in on what's happening in the hospitals and from the clinician's perspective. Dr. Wolford is a part of our team. Dr. Wolford, can you just share with us a couple of minutes about how this whole, Kirk just talked about contact tracing. We talked earlier about the testing. What implications, and the reopening of the community, what implications does that have in a clinical setting? Dr. Wolford.
Okay, can you hear me?
I can hear you now.
Okay, thanks so much. So from a clinical perspective, of course, the most important thing to us is going to be that we can do all of this with safety in mind. Safety is the most important thing. And so if we're thinking about reopening, we have to know two main things to reopen. We have to know, first of all, who is infected. Okay, and that is why we need to know about the testing. That is vital to be able to know when we're ready to open up, okay?
Yeah.
And then if we have gotten the safety down, then the next thing we need to think about is we need to think about how to avoid being, how to avoid an infection. Can you guys see what I'm writing? Is it the right way around or back to front? Okay, right way around. So the next thing we want to know is how to avoid infection. And we have talked about this, and it is worth emphasizing. It's that physical distancing. It's that hand washing, and it's wearing your mask. Those things, we just have to be sure that we do those things. And now the link between these two is where the contact tracing comes in, because we want to know who is positive, and those positive people, we want those who are not infected to be able to know if they were in contact, and so that they can either quarantine or get tested, take the right precautions. So from a clinical standpoint, when reopening begins, we want everyone to take safety, make that the priority. And that means even though the testing might be painful a little bit, not too much, do the testing and practice all the things that we've been talking about for all these weeks.
Thank you, Dr. Sue. Actually, you're just amazing. Right there, you're in with your mask and everything, making sure that you're exemplifying good practices. So we thank you for that. We're going to have just another minute. Dr. Deborah Verholden, is going to bring us up to speed on what's happening. And then we just, we're really at the close of our session today. So Dr. Froholden, you have the last word.
I'm going to be super brief. Many of you know I'm on the governor's state coronavirus task force on racial disparities. Many of you have already reached out with questions, comments, ideas. Keep them coming. I'm bringing them forward. This group is active and activated. We have 2 existing subcommittees right now on testing infrastructure and primary care access. If you want to reach me, email me, holdenc3@msu.edu.
Thank you, Dr. Deborah. And here we are at our time. We want you to subscribe to our YouTube channel, Healthy Flint. Look us up on Facebook, and then email any questions as Dr. Deborah has just showed you. We want to thank you today for all of you that joined us for the 7th Flint Community Webinar hosted by the Flint Research Coordinating Center. That email link will come to you for the survey. Please complete that for us, and you'll also get invited for the upcoming webinar. So we say thank you, and we look forward to talking with you again next week.
And don't forget, Congressman Kildee is going to be on next week.
Absolutely.
Thank you, Yvonne, our wonderful moderator. Everybody stay safe. Be blessed, everybody.